Good morning, Lord Brailsford.
Good morning, Miss Stewart. Now, your witness today?
I do, thank you, my lord. Our first witness today is Miss Foyer, who appears on behalf of the Scottish Trade Unions Congress.
Very good. Good morning, Miss Foyer.
Good morning, my lord.
Very good. There'll be some questions for you from Miss Stewart. When you're ready, Miss Stewart.
Obliged. Could you please confirm your full name?
Yes, my full name is Rozanne Foyer.
And you're the General Secretary of the STUC, is that correct?
That's correct.
And you've provided a witness statement to the inquiry in that capacity?
I have, yes.
Thank you. And for reference, that is witness number WT0817. And you've held this role with the STUC since March 2020, is that correct?
That is correct, yes.
Thank you very much. And I understand your statement's intended to focus, and indeed does focus, on the impact on workers flowing from financial support and guidance given to businesses and self-employed. And you have, of course, given evidence to the inquiry before at the Health and Social Care hearings. That was on the 23rd of April this year, and we have, for this portfolio, a very detailed witness statement from you in relation to that. So I'm not going to ask you about your professional background or about the STUC in general, except to say that that is set out in your statement from paragraph 2 and following. But I do want to ask you a bit about your organisation's engagement with the Scottish Government in very general terms. But before I do so, I want to ask you if there's anything you want to add to your statement in connection with the STUC in terms of its aims or its membership.
I think the only thing I would want to add at this stage is to make clear that the STUC represents over 200,000 members in the sectors that this module is concerned with, so, you know, out with the public sector across Scotland, and you know, that's a number of our affiliated organisations who've also put in statements to the inquiry and evidence to the inquiry about how their members were affected, that are covered by our statement also. Thank you.
And at paragraph 14 and following of your statement, you've set out the STUC's role during the pandemic. I want you to tell us a little in general terms about the nature and extent of your organisation's communication with the Scottish Government about the impact on workers flowing from the financial support schemes and the guidance.
So yeah, we obviously are an umbrella body for trade unions, and our role often is to coordinate the representation of workers' issues to government. And during the COVID pandemic, from a very early point in the pandemic, we had very intense engagement with Scottish Government on behalf of our trade union affiliates and involving our trade union affiliates, to the extent that we had a COVID group that was meeting twice weekly to raise a whole range of issues. So, you know, we would have been raising issues affecting the workers and, you know, right across the private sector who were in key worker roles throughout that period at a fairly intense level as issues were brought to us by our affiliates.
And you were able to relay these to the government through that group?
Yes.
How was the STUC able to gather the information and data from its members that you would use to inform your discussions?
So we had regular meetings with our affiliates. They knew that there was a forum that was meeting, you know, several times a week to escalate any issues to government. They in turn have a network of trade union reps across pretty much every sector of the Scottish economy where there is union recognition or collective bargaining, and these were live issues that were being fed back to us by reps who perhaps felt that, you know, guidance wasn't being followed, or there was a lack of guidance, or you know, there were maybe areas where non-essential work was being carried out that shouldn't be carried out. There were a range of health and safety issues, and so it really was for the reps to feed that back to their unions, who then escalated it through us. And from those meetings, sometimes there would then be direct meetings between whichever trade union it was and government to resolve issues, but often the issues were escalated through our COVID group in the first instance.
Thank you. I want to have a look with you just now about the Fair Work statement, which you've set out in your own statement at paragraph 39 to 44. And I understand from your statement this was a joint statement between the STUC and the Scottish Government, and you've set out the statement, the joint statement in full, at paragraph 40. Can you please tell us who was involved with the drafting of the statement?
So this was a statement that was drafted by officials of the STUC. It was actually my predecessor, Graham Smith, the General Secretary, who was personally involved in much of the drafting of the statement. And he was working with the officials in Fiona Hislop's MSP, who was the Cabinet Secretary for Economy's office, and they basically did the drafting of the statement, and it was fed into by our affiliates. I believe it was also supported by other bodies such as COSLA, SCVO, and I think SCDI from memory too.
And when was that statement published?
It was published on the 25th of March 2020, so really early in the pandemic. It was something that we felt would be necessary to give some clarity and set out some key principles around some of the issues that we knew would be likely to come up, given that we were moving into a lockdown and a crisis management situation.
Thank you. Why was the statement considered to be necessary, and what was it trying to achieve?
Well, it was about making sure that fair work principles would be applied by employers throughout a period where we knew there would be a lot of change. So we anticipated that there would be workplaces being closed down. We anticipated there would be changes to working practices, there would be health and safety issues, and there would be massive move to home working by a lot of workers. And so it was really about setting out a fair work approach to how to deal with these issues, and so it was guidance, and it was urging all businesses to make use of it and follow the guidance, but it wasn't enforceable. It wasn't underpinned by the law, given that we don't have devolved employment law here in Scotland.
And these issues, ways of working and issues that you anticipated, did that come to fruition?
So what we found was that although it was simply guidance and it was issued by the Scottish Government, it actually provided a really useful tool to reps across both the public and private sectors in having discussions with managers about some of the issues that were going to affect workers. So, you know, it actually is amazing to look at it now and realise how detailed it was and how much it preempted that had yet to really happen. But just to give a quick summary, it provided guidance on applying fair work principles throughout the crisis. It said employers should follow all the latest guidance that was issued on workplace public safety by the Scottish Government. It wanted to ensure that all workers were empowered to follow health protection advice to be able to isolate themselves at home, which became a really huge issue. It talked about the need to pay workers while off sick or self-isolating and make sure that there was no detriment to them for taking time off for COVID-related absence. And a whole range of other things which are in the evidence. But, you know, some of these things proved to become very vital issues for our reps, and they found it a really helpful tool to get their employers to do the right thing.
I'm going to come on to ask you about one aspect there of sick pay in particular, but before I do, can I ask whether or not this statement and the principles contained in that were widely adopted by employers?
I think for the most part, they were far more widely adopted by employers across the public sector than they were by employers across sectors that were not public sector or publicly funded, because the main leverage that the Scottish Government is able to use to promote fair work and get people to adhere to fair work guidance is really through public sector funding. So in areas where there was no public sector funding or indeed no trade union representation and reps there to negotiate or argue for those fair work principles, it wasn't widely adopted. But areas that were unionised, it was a useful tool to get that conversation going.
And was it effective in influencing employer behaviour, even in part?
Yeah. So you'll see in our statement from CWU, the Communication Workers Union, who operate across, extensively across different parts of the private sector, that they found it very useful in helping them to get employers in that sector to adopt good practice.
Would you say that on the whole that the joint statement met the objectives it sought to achieve?
I would say that it partly met the objectives it sought to achieve. It certainly did influence the behaviour, I believe, of a number of employers. From the STUC's point of view, it's regrettable that we don't have employment law devolved to Scotland, because that would have enabled the Scottish Government to make that more regulation-based rather than simply guidance. And I think that would have saved and protected a lot more workers.
Thank you. I've mentioned already that sick pay is one aspect I want to raise from that joint statement. And it says there, that's set out at paragraph 76 to 92, section on sick pay in particular. And you set out here, no worker should be financially penalised by their employer for following medical advice. Any absence from work related to COVID-19 should not affect future sick pay entitlement, result in disciplinary action, or count towards any future sickness absence related action. You set out in your statement at those paragraphs that the lack of sick pay, and you've mentioned already the requirement to self-isolate, was an issue for workers. Can you expand on that in terms of the nature of the issue and the extent of that problem?
So I think this is a particular issue. It was certainly an issue for workers in social care, which we've covered in the past, but when you look at workers across the private sector who work in areas like retail, hospitality, distribution, and a whole range of other areas, there's quite widespread use of employment contracts which do not have adequate levels of sick pay cover in them, so the employer will not pay full sick pay when an employee has to take time off, either for sickness or, in the case of COVID, to self-isolate. And we found that the provisions in statutory sick pay were sadly lacking where there wasn't that full sick pay in the employment contract. So you were on zero for the first 3 days of time off, and thereafter you were on just over £95 a week. And for anyone who was below the lower threshold of earning £120 a week, you were getting nothing. So for low-paid workers, this was no choice at all. If you're not funded and financially, if it's not viable to take time off or to choose to isolate, this was a real issue that would affect some of the public health policies that we were trying to implement to stop the spread of the virus. So that became a huge issue for us. And while we were successful in getting government to take action to put a sick pay scheme in place for social care workers, which they had, quite a lot of influence over because so much of that is publicly funded in Scotland. There are all these sectors in the private sector that we weren't able to get anything in to cover or go above and beyond the minimum level of statutory sick pay that the UK government had in place. So this was a massive hole, really, in the government's whole public health strategy, in our view.
And when, during the pandemic, did it become apparent that this issue with sick pay was such a problem for workers?
Yeah, it became apparent quite early, and it's one of the reasons that we wrote it into the Fair Work principles. But we started to receive feedback fairly early in in the piece that this was a problem. I think we raised it with Kate Forbes, Cabinet Secretary for Finance at the time, on the 12th of March, and asked if she could compel all employers who were in receipt of any kind of government funding or support to provide full sick pay to those who had to isolate or take time off sick. We included it in the Fair Work Guidance. In May, we raised the concerns with the Health Secretary around the social care workers in particular. And, you know, we continued to raise this as a key concern, really, at repeated meetings that we had, and that'll be in some of the minutes that we've provided in the notes of those meetings.
Thank you very much. And you've mentioned the impact on the social care sector already, but were there other sectors most impacted by the lack of sick pay, or certain cohorts of worker perhaps?
Yeah, well, I think when you look at some of the workers who work in, you know, some really quite low-paid jobs in food processing, if you look at some of the workers that are involved in distribution and deliveries, if you look at some of the workers involved in hospitality and in retail, you're talking about a lot of low-paid workers, often on precarious contracts, often women, young people and people from ethnic minority backgrounds. And, you know, these tended to be the areas where, you know, these were key workers who were out doing essential work, but they tended to be areas where people were not being able to access adequate financial support to take time off if they were beginning to fall ill or indeed needed to isolate. And, you know, it's no choice at all. If you can't have money to put food on the table for yourself and your family, then you can't really follow the COVID regulations appropriately. So we were really concerned about it, and we were getting a lot of feedback from our different affiliates of cases where that's actually what was happening.
And in terms of the impact on these workers, you've perhaps alluded to it already, was it that they went to work when they were unwell, or that they remained at home and struggled financially? What was the impact?
Well, we believe that in many cases that there would have been workers who perhaps were avoiding testing, avoiding, you know, isolating at times when that they should have felt much more comfortable about doing so. But I think that you can't really blame workers if they're, you know, it's going to cause deep financial problems if they're going to feel that they have to keep working. And in some cases, you know, we had employers who were given guidance that was against Scottish Government guidance, that may be in line with UK policy, that they should keep working as well. So, you know, with all these things against them, it was very hard to expect low-paid workers who weren't going to be in any way financially supported to follow the guidance appropriately.
And you've mentioned in your statement, you use the phrase that reliance on statutory sick pay created perverse incentives, and that's what you're referring to there.
Indeed, that's absolutely right.
Thank you. And at paragraph 86, and indeed you referred to it already, you mentioned the Social Care Support Fund. Can you explain how and why this support fund came into being?
Yes, we actually had been raising that from very early, and we seemed to get some movement on that in May 2020 when we had a meeting with the National Clinical Director, Jason Leach, and the Cabinet Secretary for Health, Jean Freeman, that month around this issue. And towards the end of that month, they did set up a fund for social care. That was a big help, and actually that fund kept going until the end of March 2023. And, you know, when you think about all the sort of close proximity that social care workers work in, we actually think that fund should have kept going to, you know, to this day, because it's not a situation you want as workers going to work if they're carrying infection or viruses or illness, but particularly for the pandemic, you know, that was something that the Health Secretary, I think, saw as a priority that had to be dealt with, and recognised the concerns we'd raised. It probably wasn't within Scottish Government's gift or budget to be able to compensate right across the economy for every low-paid worker. At the end of the day, that would be, you know, something that we would have needed the UK government to step in and deal with, and, you know, change the statutory sick pay. If we could have had a statutory sick pay that was equal to the minimum wage, for example, that would at least have protected low-paid workers.
Thank you. You say that some of your affiliated unions highlighted that some employers refused to adopt the scheme or failed to adequately inform or notify their employees about it. I wanted to ask you how was information disseminated about the scheme in the first place?
So the government, I believe, promoted it through their networks to employers, and obviously across social care, government is a key funder, so that they had mechanisms through local authorities, etc., to be able to do that. We, for our part, made sure that all of our trade unions who had members in social care, whether it be in the public sector, the private sector or the third sector, were fully aware of those provisions. And you're right, in some cases there was no way that they could make the scheme available to employers, but the employer had to apply to use it, and we've got evidence of some employers who just didn't take those steps despite being asked to by the trade unions representing the workers in there.
And why was that they didn't take these steps?
I think they perhaps felt that administratively it was too much of a responsibility on them, and they could get on fine without it wasn't impacting them, it was impacting their employees. You'd really have to ask them what the motivation was, but it was pretty shocking from our point of view that that's not something that any employer operating in that environment wouldn't take seriously and see as a real benefit.
Thank you. And how widespread was the issue you've described there with them not adopting the scheme?
I don't think it was that widespread, but I think the fact that we've been able to, I think GMB, one of our affiliates who have members who are private sector social care members, had given us some examples of that, but I wouldn't say it was a massively widespread issue, but certainly shocking that was an issue at all.
Thank you. I want to turn now to asking you about the definition of essential or key worker. You've set out your evidence in connection with this at paragraph 120 and following, and you explain there that the STUC asked the government to provide guidance on the scope of non-essential work so as to ensure clarity. Can you explain for us what in particular needed to be clarified through that guidance?
Yes, our concern was that the government had highlighted, certain sectors as essential sectors, or large occupational groupings, and for us, the real question was: is the worker actually being asked by their employer at this time to carry out work that is essential? So we had a range of our affiliates who had raised issues with us. Unite in particular raised numerous examples of construction workers and energy workers carrying out work that they didn't feel was essential, and the workers didn't feel that they felt they should have been furloughed rather than being asked to carry out that work. And we really felt that there needed to be more clarity given to that, because we felt it was a loophole almost that employers who happened to be in sectors where some of their work was essential without a doubt, and we wouldn't argue with that, were actually carrying out much more widespread activity than you would expect in a full lockdown for all of the reasons that we were having the lockdown.
And is it the case there were, initially at least, gaps in those who were afforded key worker status?
Yes, there were some issues, particularly USDAW raised this, that it was very important to be able to get that key worker status, because that affected your ability to access things like the emergency childcare that local authorities were putting on for workers who were key workers when the schools were closed, etc. And a lot of people who were working in areas like food processing, food distribution, food retail were not being properly classed as key workers, and therefore unable to access that sort of support. So that was another area that we raised and had concerns around.
And is that something that was addressed by the Scottish Government?
Certainly wasn't addressed adequately at the point of the first lockdown. I know that USDAW were very disappointed because they'd written to the DFM and the FM on the issue, and you know they didn't make the full list during the first lockdown, is my understanding.
Can I ask you just to clarify the full name of the union you're referring to there?
USDAW is the Union of Shop, Distributive and Allied Workers.
Thank you very
Distribution
much.
and Allied Workers. Thanks.
Thank you very much. I want to turn now to asking you about impacts on particular cohorts of worker, and you've mentioned some sectors already in your responses around sick pay and key worker status, but the inquiry is keen to learn about disproportionate impacts. So I want to ask you further on this in relation to some groups, and you've set this out at paragraph 145 to 152 of your statement.
Yep. Yeah, I mean, there were a number of disproportionate impacts. I would say actually social economic factors were the first disproportionate impact. That, you know, COVID was very much a class issue and actually a class killer in some respects, because when you start to dig into the evidence about the occupational groupings of you know, the statistics on deaths in Scotland from COVID, you can see that it impacted on lower paid workers massively, and that it happened to be those in lower paid occupations who we all deemed essential, but who ultimately were the ones going out every day, going to work in close contact with other workers and with members of the public who were put to much higher risk and not adequately protected. But if we also dig into that and look at other you know, disadvantaged groups with protected characteristics, you can see that women were impacted, particularly through issues around caring. So you had women who, you know, were not able to access time off work, and yet their children perhaps were not at school. The caring responsibilities for children fell mainly on women, but also for older people. So I even know, you know, an example on my own part was that my parents, both in their late 80s, had their whole care package withdrawn, so I had to go and bath my mother twice a day at the same time as you know, doing my full-time job. And I would imagine that would be the experience of women up and down the country, as you know, things were reduced to the absolute essential cover only. That continued for about 6 months, and that would have been the experience of a lot of people. But the really big area of disproportionate impact actually fell in relation to black and ethnic minority workers. We started to see some really disturbing evidence of higher infection and death rates, and we also were really concerned, you know, from pretty early on. I think we wrote to government on the 22nd of May 2020, because anecdotally the figures we're looking back on now and seeing where, you know, people of Pakistani origin were 3.7 times as likely to have death involving COVID than people from a white Scottish ethnic background, and other minority groups were also several times more likely to die from a COVID-related death during that period. But we wrote to them to just say that we were very concerned about the lack of disaggregated figures that were being collated and collected in Scotland, and we were hearing anecdotally that this was impacting much more on black and ethnic minority groups, but we needed more government to pay closer attention to that, and it's certainly something I know that other organisations raised with government also as an issue. There was also an issue around the uptake of vaccines much later on among people from ethnic minority communities. And I suppose the final area to raise in terms of disproportionate impacts was the disproportionate impact on people with disabilities or chronic conditions, and that kind of we started to see some of that coming up around, you know, the impact, the mental health impact of self-isolating, and, you know, the need for them perhaps to be a lot more careful with some conditions than others were, and for their self-isolation and sheltering to go on for a lot longer, or shielding, I think was the term used. But also, you know, there were some people with disabilities that meant they couldn't wear face masks, they couldn't adhere to the guidance and regulations, and it wasn't always a visible disability, but that actually made life very difficult for them to be able to go about their business and not feel that they were being targeted for rule breaking or you know, not following the proper guidance at the right time. So there were a whole range of disproportionate impacts, but I think it's fair to say overall that, you know, COVID hit people who were the poorest the worst, and it also hit people who were in the most vulnerable groups the worst, and the figures bear that out.
Okay. I wanted to ask you there, I'm seeing here in your statement at paragraph 146, you explain the detrimental impact that shielding had on the mental health of workers with underlying health conditions who are protected physically by shielding, that they became isolated and demoralised. I wonder if you want to expand on the mental health impacts of that for that group.
Yes, I mean, I think that it's fair to say that lots of people who moved to a home working model had mental health impacts and feelings of isolation. We picked up that a lot of young workers as well were feeling that, but I think for people who had a disability and were shielding, it was particularly difficult. They went through what many people went through and the isolation that many people went through, but for them there was no end to it. So as the economy started to reopen, that became a very frightening time. We had a lot of cases where, you know, employers weren't necessarily understanding the nature of people's health conditions and the reasonable adjustments that might need to be put in place to ensure someone could continue to work at home if everyone else had moved away from that model. But equally, you know, just having to be shielded away, once everyone else took their masks off, it made a certain group of people with certain conditions, you know, even more vulnerable, and they had to shield even harder, if you like. And that, you know, we've had a lot of, through our Disabled Workers Committee, we've had a lot of people sharing the sort of impacts that had, and they absolutely were of a mental health nature. And that's difficult at a time when our mental health services have, you know, were also under extreme pressure, and, you know, we've had extreme lack of funding for those services for decades, so they weren't really prepared to deal with the sort of issues that were coming up.
Thank you. There's one cohort I wanted to ask you about, which you include in your statement that you haven't mentioned, and that is the guidance for pregnant workers and the delay in providing and applying that guidance. And this links back to the provision of sick pay.
Yep. Yeah, there were impacts on pregnant women workers who had to take statutory sick pay rather than maternity leave to shield, because there wasn't a recognition there for some women by some employers that, you know, that was a necessity for them at that time. So it was just another one of those areas that, you know, it actually in some cases meant that they weren't able to get the length of maternity leave as well that they would have wanted to be able to have, because they were having to use up leave, sick leave, eat into things that they shouldn't have had to eat into in terms of the provision that was there for them, when it should have been recognised that COVID placed an extra burden on expectant mothers in terms of the protection of their unborn child.
Thank you. And I just have a question for you. You mentioned the availability or the gathering and availability of data in connection with some of these disproportionately impacted groups. Is that something you were able to speak to the government with to some degree of success in obtaining that?
I believe that it did trigger more disaggregated statistics being gathered. It was a deliberate attempt by us to put some pressure on Scottish Government at the time to say that this is not something, you know, COVID wasn't the first time that we'd raised the lack of statistics at a Scottish level on impacts on ethnic minority groups for all sorts of things, but I believe that it did have some impact in terms of, you know, getting them to take a look at that area when we raised those issues. That was certainly our impression.
Thank you very much. I want to turn now to asking you about what was taking place in contact centres in relation to essential work. At paragraph 109, you set out there were issues identified in relation to contact centres operating, although they weren't carrying out essential work, and you say the working conditions of people there were unacceptable. Can you explain for us what it was about the environment that made it so?
Yes, we've actually included a report in our evidence from Professor Phil Taylor at Strathclyde University that did quite a lot of research into this, and it was quite disturbing, the results of that research. And so I would recommend to the inquiry to take account of that. But yeah, there were real issues identified in contact centres. First of all, there was an issue that too many of them were still operating when actually we felt the technology and the ability existed for them to move to a home working model, and many employers were not choosing to do this. They were saying it wasn't possible for them to do so, when our views, the representative of those workers was that it was perfectly possible to do so. So as a result, we had a lot of call centre workers who were continuing to work, and you know, the work they were doing, they were designated as key workers, and they were having to use public transport in many cases because a lot of these jobs are not well paid. But inside the working conditions in the call centres, we were really concerned about. Many of them are office environments with, you know, traditional air conditioning units for heating and cooling that recirculate air, which is one of the worst sort of systems you could have to combat or to stop the spread of a virus like COVID-19. They work at close quarters, they hot desk, so it was a perfect storm really in terms of the sort of conditions that would potentially lead to the spread of infection or the spread of a virus. So we had a lot of call centre workers contacting us who weren't represented by unions as well, to say that they were very, very scared to go to work each day. And as a result, we actually set up a campaign to start to put some pressure on these employers and on the government really, to say, you know, we need more guidance, more regulation, and we need employers to set up the home working for people.
Thank you. And that report you've referred to from Phil Taylor that you've provided to the inquiry will of course be taken into consideration alongside your statement and your oral evidence today. I think you were perhaps going to come on to it there. The problems you've described, they led to the STUC establishing the call centre collective. Can you just describe for us what that was intended to achieve?
So we realised that there was a need to raise awareness among call centre workers. We did actually, you know, by that point had started to draft guidance on what safety standards should be, and we did that in conjunction with Scottish Government. We developed guidance around, you know, if you are in a call centre and you have to go in, step one, don't go in if you don't have to, and let's set up home working. But step two, if it has to be done in the call centre, then there should be proper distancing, there should be proper safety mechanisms in place, there should be proper ventilation and proper cleaning and all of the steps that to prevent infection that needed to be in there. And we raised awareness among call centre workers that this guidance existed, that it should be followed by employers, and did that a lot through social media and through promoting that guidance to workers, and encouraged them to collectively try and address, if they weren't in a unionised workplace, to collectively try and address those issues and join together as a group and form a union and address it with the employer. But we also empowered our reps with this guidance in unionised areas so that they could make sure that employers were following the right safety practice.
And what came first? Was it the guidance or the formation of the collective?
I can't actually remember. I think that they sort of happened around the same time. We did agree with the Scottish Government there was a need for guidance across a whole range of different settings, and I think we've given you other evidence that shows all the different guidance that we produced over that period. I actually can't remember which came first, I'm sorry.
Thank you, but as you say, we have the guidance that you've referred to there. Did the collective achieve what it sought to achieve in terms of what you've set out for us there, in terms of home working, for example?
I think that we certainly noticed that there was, due to some of the public pressure, because we'd set up an actual campaign and done things through the media and social media, etc., that there was a move. Certainly CWU felt that that's the Communication Workers Union, felt that it had been impactful and helped get more employers to move to a home working model, which they felt was the big necessary move. And you know, we saw some impact of it, but it certainly wouldn't have covered all the areas we would have wanted to see it cover or reach. And part of that is about the fact that we don't have the reach we would want to see in terms of unionised workplaces across the private sector.
Thank you. I want to move on now to asking about what you term the reopening of the economy. At paragraph 126, you talk about the briefing paper you provided to the UK government and the Scottish government on leaving lockdown, and in that you outline 5 essential areas the STUC considered essential to be in place prior to restarting the economy. Could you, in general terms, explain the rationale behind these essential areas? I'll leave it to you to choose which you want to focus on.
Yeah, I mean, this was something that we started to address really quite early in the pandemic, because we understood that you couldn't keep a lockdown going forever, and that I think the government talked about the balance of harms, and you know, at the end of the day, the economy needs to keep going so that people can get paid, so they can feed their families, etc., etc., and the need to avoid you know, complete economic meltdown is as big a public health issue as, you know, avoiding a pandemic. And so there was a balance there, and we recognised that balance would be there, and there would be a decision at some point, whatever stage the virus had got to, that we couldn't stay in full lockdown, you know, indefinitely. There would have to be a managed and safe way of reopening the economy, and so we wanted to make sure that workers' voices were considered and their needs were considered in the plans that we knew government would start to put together on that. So the key areas that we really felt government had to address if they were going to think about reopening the economy, and I think it's important to say that, you know, this was in May 2020 that we shared this first paper, so the prospect of a mass vaccine programme was, you know, the stuff of dreams at that point. It certainly wasn't something that we felt was a reality that was going to definitely happen or that we could rely on. So we felt that there really needed to be greater capacity for community testing and tracing, which at that point there really wasn't enough capacity. There wasn't a proper system in place for testing and tracing. A lot of people found it very hard to get tested at that stage. We also thought that there needed to be much more capacity to supply appropriate PPE to non-essential workplaces, because at that point in the pandemic we were struggling to supply it to the essential key workers that were working through the lockdown. So the idea of scaling up to make sure that all workers had access to the sort of PPE and safety practices they would need, we felt was something that had to be given due consideration. We also felt that the sectoral guidance that we'd started working on with the government, that we would want to have sectoral guidance in place for all the non-essential areas, so that people would have something to turn to help them do their best to protect themselves in terms of health and safety guidance. We thought there should be more effective enforcement measures because we were aware that we were working with a government who we felt was, you know, was cooperating and working with us and taking our views on board in Scotland. But we were concerned that they didn't have the teeth because of the lack of employment law, health and safety law being devolved. They could issue public safety guidance, but there was no real enforcement there to make sure that that was adhered to. And we also felt that there needed to be a continuation, a guarantee that the job retention scheme, which was obviously a UK provision, but a very important one for workers who were furloughed and who were not in working in essential roles, we realised that there would need to be a phased approach to reopening the economy. It couldn't happen all at once immediately, and therefore we needed to know that for those workers who were towards the back of that queue, that the furlough scheme would continue, or whatever financial support the Scottish Government had put additionally in place for self-employed workers, freelancers, etc. So those were our kind of big 5 principles that we started to talk to government about at those very early stages. You know, should we get to the point of reopening, these are the things we want you to have in place before you reopen, in effect.
And from your perspective, or the STUC's perspective, were those things put in place prior to our reopening?
Some were, and some weren't. I think that, for example, the furlough scheme, we were on a precipice on a number of occasions with the UK government. I don't have the exact dates to hand, but, you know, I can remember us all, you know, at times when Scotland still felt lockdowns were necessary and that large groups of workers needed to be locked down and be able to access the furlough scheme, there were real fears the Chancellor would withdraw it completely. And there was intense lobbying going on to prevent them from doing that. And you would hear, like, the night before or a few days before the axe was about to fall, that actually they were going to keep it going a few more months. But sometimes for some employers that was too late, and they'd already, you know, gone into liquidation or made their workers redundant. So there were some really difficult periods with that. And there were also, I think what they did do well with in the Scottish Government was, you know, putting the test, trace and isolate programme into place, employing people to be able to carry out that work. You know, there was a greater capacity built for the community testing and the tracing, and we all eventually were able to access the free tests, etc. So some things were put into place, but to a large extent, the Scottish Government inevitably just had to follow what the UK did at the end of the day, because the furlough scheme was everything in being able to have an economic lockdown at any level. If people can't access that furlough scheme, then, you know, I feel that the Scottish Government almost inevitably had to open up, because they weren't able to fund that if the UK Government weren't going to. So ultimately I think the timetable was dictated from there, and we had to just deal with that.
Thank you. And we will of course come on to looking at the decision making and the implementation in the course of this inquiry. Just one more question for you on this reopening of the economy. You were advised by one of your members that the guidance on returning to work could have been more specific in connection with the measures to address the concerns of those who had caring responsibilities. What was it about that guidance that was lacking in connection with that cohort who were carers?
Yeah, I believe that was one of our unions in the finance sector that raised that particular issue, and I think that this is, you know, one of the many problems that reps were encountering on the ground, was that, you know, an employer could choose. There was wording in there to say that you know, someone returning had to feel able to do so, and there was a bit of dubiety about whether, if you had either elder or childcare responsibilities that were preventing you from moving from home working to returning into the workplace, was there, or from furlough to returning into the workplace, was there, you know, was that a viable reason or not? I believe the union was able to successfully negotiate the protection required for workers. But again, when you think about all of the areas that aren't unionised across different parts of the private sector, I think it shows that some of the issues that many workers would have, you know, not perhaps been as supported in dealing with out there.
Thank you. The last section I want to ask you, Joanne, is about the enforcement of measures and the impact of that on staff. And you set this out at paragraphs 143 and 144. And you explain here that frontline workers, and the example you use, or one of the examples you use, is in relation to those working in transport, and you set out they were required to effectively police the public's adherence to guidance. In terms of the impact that had on workers, I wonder if you want to elaborate on that.
Yes, I mean, I would say this was an issue particularly for public transport workers and for retail workers as well. We came across that issue for those workers also. And, you know, this was to do with the fact that, you know, there were rules in place about mask wearing, social distancing, etc. And people using shops, food shops, or using public transport were expected to adhere to them. But at the end of the day, it was the workers on those services that were really left to deal with the issue if someone wasn't adhering to the rules. And those workers are low-paid workers. They don't have any empowerment to be able to dictate to people that they should be following what was, in effect, the law. And the police, you know, couldn't be everywhere to enforce these issues. So there was a real issue, and actually it became really problematic because you had a lot of antisocial behaviour reports. Sometimes it was people who were refusing to do the right thing. Other times it was people getting highly agitated and aggressive because someone else wasn't doing the right thing and they expected the member of staff to deal with it. So there were real issues of people facing unacceptable levels of abuse from members of the public that really did have a detrimental impact on their stress levels, their own mental health. They were just there doing their job, putting themselves and their families at risk also, and trying to navigate some very difficult situations on a daily basis. So it really took its toll. But I would also say there was an impact on union reps as well in workplaces because there was a real lack of enforcement around all of the workplace guidance too, coming from the agencies like the Health and Safety Executive or Environmental Health at local government level, who enforce the public safety measures, and they have been very depleted. They have very low resources at the beginning of the pandemic to begin with. So, you know, the idea that you would be able to refer to them to enforce anything was almost laughable during the pandemic. So it was left to union reps to almost police and enforce where, you know, if there was managers or employers who weren't following the guidance, to try and raise that, check it was happening, and that placed a lot of pressure on, at the end of the day, employees who are just individuals who take on the role of a rep on a voluntary basis, and yes, they get training, etc. But it was a really tough time for a lot of workers.
Okay. I want to just build on something you've said there about the mental health impacts and indeed the ongoing nature of that. You say at paragraph 143 that there's been an effect on workers' mental health arising from the rise in abusive and antisocial behaviour since the pandemic. So it sounds from that it wasn't just during the pandemic or the enforcement, it's more a prolonged impact.
Yeah, I mean, I think that there is undoubtedly been a disturbing pattern that's arisen. I think there has been a huge mental health damage on our society at some levels, and you know, we've seen some real burnout among staff members, and it's still, the legacy of COVID is still happening across these different services and workplaces to this day. You can see it in the health service, but you can also see it in many of these service-based front-facing occupations as well. And there has been a sort of deterioration in standards in terms of how some members of the public treat workers who are trying to go about their daily business and you know, enforce the rules of the organisation they work for. It's certainly something that we've seen, and it's not dissipated. It's sort of stayed at those levels, and I think even, you know, I know we're looking at wider business, but even if you look at behaviour in schools, there seems to be a pattern where that's taken a dip post-pandemic, you know, violence against teachers and things. And I think there is something about perhaps what we've collectively been through as a society, going through COVID and then straight into a cost of living crisis and everything else. You know, the levels of deprivation, poverty, societal breakdown that we're actually dealing with in working class areas has an impact, and it has an impact on workers out there delivering services on a daily basis.
Thank you. I just want to ask you in closing whether you have any suggestions for what the Scottish Government should do to mitigate the ongoing impacts arising from the pandemic. And you made plain that it's the pandemic and also other factors. You mentioned the cost of living crisis, or indeed whether there's anything they could do differently in response to any future pandemic or similar emergency.
Yeah, I mean, there are lots of things that we need to think about. First of all, the resilience of our services and the preparedness, and I've given evidence about that. You know, I won't go into that too much, but just thinking about it from the point of view of this module and workers, you know, across business and the private sector, we're talking about, you know, just over 2 million of Scotland's workers who are employed across the private sector. We've got 18 different affiliates with significant membership in these areas, and you know, as I said, we've got over 200,000 trade union members across all different parts of the economy that are not public sector. But I think it needs to be remembered that around 90% of workers across these parts of the economy don't have the protection afforded by being employed in a unionised workplace, and there's lots of research that shows that in a unionised workplace you would usually be able to enjoy higher standards of health and safety and compliance with fair work practices and more, you know, practices in workplaces of that nature. And so many of these workers were on the front line during the pandemic in some of the most vulnerable, low-paid, high-risk areas of employment, like food factory workers, contact centre workers, distribution workers, food retail workers, hospitality workers and public transport workers. And I think, you know, as I've said, COVID was definitely a class issue for those in those lower paid occupations. They suffered more severely during the pandemic, and the figures show that those in those lower paid occupations had greater contact with other workers, they relied on public transport, and they were disproportionately exposed to this virus and more likely to die as a result. And we've talked about the evidence that shows that impact also fell on disadvantaged groups, such as women, disabled workers, BAEM workers. And I don't think there can be any doubt that the lack of adequate both employer and statutory sick pay provision played a massive role in undermining the public health policies that were designed to stop the transmission of the virus, given that too many of these low-paid workers lacked any viable financial support to take time off work when it was really necessary for them to do so. And there can also be no doubt that there was a serious lack of implementation across lots of these areas and enforcement of workplace guidance and public safety guidance that should have been followed by all employers. You know, it absolutely should have been followed by them. And that wasn't addressed by the government. And, you know, that non-compliance with the guidance, I believe, was widespread. So it's our view that there's too many workers across this part of our economy in particular that were exposed to unnecessary risk due to the safety guidance and best practice not being enforced effectively, and the lack of proper support for workers to take time off. And that ultimately resulted in a really tragic loss of life to an utterly essential group of workers, but a very vulnerable group of workers. And some of that loss of life could have been prevented if we'd done things differently. So for me, the lessons of the pandemic are ensuring that more workers get proper protection if they're expected to work through any pandemic in the future. And to this end, I think we'd specifically call for measures that recognise COVID-19 as an occupational disease and ensure that all those that have lost life as a result of contracting COVID at work or are still suffering from long COVID now can be compensated effectively. We'd like to see consideration around further devolution of employment and health and safety laws in Scotland so that they sit alongside and complement public safety guidance and the public health duties that the Scottish Government hold. We'd like to see some more support measures to ensure that employers pay full sick pay as part of workers' employment contracts, and that statutory sick pay is paid to at least the level of the minimum wage to protect the low-paid and precarious workers. And we'd also like to see more steps that enable trade unions to access workers across these areas of the private sector and to assist with implementing collective bargaining with trade unions so that we can have better health and safety practices and better fair work practices, because ultimately, you know, in a pandemic, that bad employment practices caused loss of life.
Thank you very much, Ms Foyer. I don't have any further questions for you, my lord. That concludes my questions for the witness, unless there's anything further.
Well, thank you very much indeed, Ms Stewart. Yes, thank you, Ms Foyer. That's all. Take a break now till 11:15.
Thank you, my lord.
Good morning, my lord.
Good morning, Mr. Turner. Now, a witness for me?
Indeed, my lord. The next witness today is Ms. Joanne Cairns from the Union of Shop Distribution and Allied Workers, commonly referred to as USDAW.
Thank you. Good morning, Ms. Cairns.
Good morning, my lord.
Now, when you're ready, Mr. Turner.
Thank you, my lord. Ms. Cairns, before I begin, could I just give you a reminder, we have spoken before that the hearing this morning will be transcribed. So if you could try and speak as slowly and clearly as possible, that will help the stenographers. Could I ask you please to state your full name?
Joanne Marie Cairns.
Thank you. And you're here today on behalf of USDAW, is that correct?
That's correct.
And what is your position with USDAW?
I'm the Head of Research and Policy.
Thank you. And how long have you held that position?
I've held that position since March 2021. Prior to that, I was the Deputy Head of Research and Policy.
Thank you. And you have provided a written statement to the inquiry, is that correct?
Yes.
And my lord, that, for the record, that is SCI WT 07171. And that statement, Ms. Cairns, is that statement purely from your own knowledge, or is that organisational knowledge?
It's a mixture of both. It's mainly organisational knowledge because I am based at our head office in Manchester, so there's a number of things referred to there that involved other colleagues who were in Scotland, but I was involved in supporting those colleagues throughout the pandemic.
Thank you. I'm going to ask you now a few questions about USDAW, just to give His Lordship an indication about the group. Constitutionally, could you tell us what USDAW is, first of all?
USDAW is a trade union, an independent trade union, and we organise mainly in the retail sector. So we have 365,000 members across the UK, and 38,000 of our members are in Scotland.
Thank you. And you said mainly in the retail sector. What other sectors are you involved with?
We're also involved in distribution, road transport, food manufacturing, pharmaceuticals, and funerals.
Thank you. And what is the purpose or the aim of the organisation?
The aim of the organisation is to represent workers in the industries where we organise to achieve improvements in their pay and conditions.
Thank you. And how is USDAW funded?
We're funded through member contributions. We have a small income through advertisements in our journals, but it's almost entirely through membership contributions.
Thank you. And you mentioned there the members that you have across the UK. I take it from that USDAW is a union that represents people right across the UK. Is that correct?
Yeah, that's correct.
Thank you. And in terms of organisationally, where does Scotland sit as part of USDAW?
Scotland is geographically a region of USDAW, so we have 7 regions, and within Scotland we have a regional secretary and deputy regional secretary who run the Scottish region, and we have a number of area organisers working in Scotland as well. We have 2 offices currently, Glasgow and Aberdeen, but during the pandemic we also had an office in Edinburgh.
Thank you. We're here today to talk about, or primarily about, matters relating to term of reference 2L of the inquiry. And just to remind you, that's financial support and guidance given to businesses and the self-employed, including in relation to identification of key workers by public agencies. I'd like to talk to you first of all about the guidance element of that. Did USDAW have any input into guidance during the pandemic?
We did have some input. Our regional secretary, or divisional officer was the title at the time. It's since changed to regional secretary. Our Scottish divisional officer represented USDAW on what was called the retail subgroup with the Scottish Government, and through that we did have some input into guidance specific to the retail sector. We also, via the STUC, had input into wider guidance.
And how was that input given? In what forum?
It was mainly verbal in the retail subgroup meetings. I think some of it was also submitted through email. And
in terms of that input, did the Scottish Government take that input on board?
In some cases, yes. So, for example, when face coverings were introduced in shops, were made mandatory in shops, we did see an early draft, I think, of the guidance. We gave some feedback on that to say that it should be made clear that retail workers were not expected to enforce that mandatory face covering, and that was included in the guidance. However, there was, I think, other occasions where we put things forward that were not necessarily taken on board by the Scottish Government. For example, when social distancing was reduced from 2 metres to 1 metre, we expressed concerns about that and said that we didn't think that was necessary or safe, and that we never got a response on that. That was in the form of a letter to the First Minister.
Thank you. You may not know this, but was there any indication as to why that was not taken on board?
We just didn't get a response at all.
Right. In his discussions with the Scottish Government, did Mr Forrest express any view in terms of the attitude of the Scottish Government?
The view he expressed to me was that there was a lack of understanding of the reality on the ground in retail. I actually spoke to him again prior to this hearing just to sort of get his recollections, and he said that again more recently.
Thank you. Are you aware of any other specific examples of input that you had in relation to retail guidance?
Not specifically. I think there was many conversations going on at the time. A lot of it was not. I don't have minutes of the meetings, and I wasn't at the meetings. I know that that the divisional officer raised issues around social distancing, abuse of retail workers, and other issues like that. I don't know what the output of that always was.
Thank you. Turning away from retail guidance specifically for a moment, and thinking more about the general guidance that was being issued by the Scottish Government at the time, did USDAW have any input in relation to that?
I think that was via the STUC and their discussions with the Scottish Government, but that's not something that I have a lot of detailed knowledge on. I know there was an issue relating to key worker status where we attempted to have input onto that because at the start of the lockdown, when childcare provisions were made available to key workers, we were concerned that the guidance that had been given by the Scottish Government to local authorities didn't specify which occupations would be covered by those key worker provisions, whereas in England there was a list of occupations that would be covered, and it made it very clear that retail workers would be covered. In Scotland it was referred to as Category 2 workers, which it refers to people who are workers who are critical to national infrastructure. It didn't specify food retail workers. So we wrote to the Scottish Government, we wrote to John Swinney, who was the Education Minister at the time, I believe, to express our concerns about that and to request that a detailed list of who would be covered be provided to local authorities. That didn't happen. We wrote to the First Minister also to express our disappointment about that. And again, that didn't happen. We didn't get a response other than a response from an employee of the Scottish Government, which was simply a link to the guidance that we'd already raised concerns about.
Thank you. Just for putting this in context, Ms. Cairns, when was this occurring? Are you able to tell us that?
That was March 2020.
Right. And do you remember when you first raised concerns, or USDAW first raised concerns regarding the guidance?
I think it was the 20th of March. It is in my statement.
It is.
Yeah.
And I can confirm it does say the 20th of March in your statement. I should say this isn't a memory test, but you're doing very well so far. Thank you. If I could perhaps now turn to the issuing of guidance. Did you have any concerns or matters in relation to when guidance was issued?
I think the main issue that we had was that guidance was published very late in the day, often very last minute. So the obvious example on that is the guidance on mandatory face coverings in shops. As I say, we did have some input into that, which we appreciated, but it was announced, I think, on the 2nd of July 2020 that face masks were going to be mandatory in retail settings, and the announcement was that that would be from the 10th of July. The guidance was not issued until the 10th of July. So that gave us very little opportunity to engage meaningfully with employers about how it was going to be implemented, and also to make sure that our members were fully informed about what the impact of that was going to be on them. So it caused quite a lot of confusion and concern to our members.
Thank you. And you mentioned there, obviously communicating with your members. When guidance was issued, what was USDAW doing with it?
We would, first and foremost, we would make sure that we were speaking to employers and making sure that it was being implemented. So there were discussions going on pretty much constantly with employers about the latest guidance and making sure that it was being properly implemented. We also engaged directly with our members, so we sent regular emails to our members, which some of those were sort of generic emails, but some of them were particular to the different devolved administrations, so we would send things just to our members in Scotland whenever there was a change in the restrictions in Scotland, for example. We also were updating our website regularly. We had lots of information on there and links to further information. We actually found there was a lot of demand from our members for that information. They were coming to us for it. And I think perhaps that was partly because we kind of took the government guidance and then tried to make it as accessible as possible to our members.
Thank you. And in that context, then, the question of timing of the guidance, was that an important consideration for you?
It was very important, and I think the timing of some of the announcements meant that we were literally sometimes working through the night to get things ready for the next day so that we could get to our members as soon as possible.
Thank you. You've mentioned their concerns or about some input that you gave that wasn't taken on board, but generally, if I can ask you to generalise, what was USDAW's attitude towards the measures which the government was putting in place?
Generally, we were supportive of any measures that would keep our members and the public safe. It was obviously a very confusing and distressing time for everybody, but particularly for our members who were working on the front line in retail. The situation was moving very quickly, so we appreciate that the government was under some pressure to make decisions and had to make decisions quickly, so we tried to be as constructive around that as possible, but I think what we really wanted was just engagement and as much notification as possible.
Thank you. I'm going to ask you this question twice. Once in relation to the start of the pandemic, around when guidance and things started to come out, and then I'll talk about the sort of later position. But if I could, thinking about the start of the pandemic and as we were moving in, were there any particular concerns being raised around that time regarding the guidance being introduced?
I'm not sure I can remember particular concerns about the guidance, other than the general concerns that people were raising about just not knowing what was happening. I think, again, it comes back to the timing of things, and sometimes things perhaps not being completely clear. I think we worked with the British Retail Consortium and Scottish Retail Consortium on producing guidance for the retail sector, and I think it's quite telling that we worked on that together, and I think what came out of that was really clear, pragmatic guidance that because I think there was a real need from both employers and workers for clarity on a number of issues, and I think we worked on that together jointly, and that demonstrated to our members that we were on board with that. They felt comfortable, and it helped them to feel safe going to work. So the guidance itself, I think sometimes it was quite complicated. The fact that there were different sets of guidance in the different devolved administrations also caused some confusion as well amongst our members sometimes.
You talked there a moment ago about your work with the Retail Consortium and introducing guidance. Was there a reason why you were doing that?
It was primarily because we wanted to work jointly to make sure that both retail employers and retail workers felt comfortable and safe, and retailers wanted to stay open, and there was obviously the non-food retailers were reopening, and they, I think, learned from the experiences of the food retail employers who had stayed open throughout, where social distancing was basically pioneered. So I think it was helpful to those retailers who'd been closed and were reopening to learn from those experiences, find out what worked well and what could be improved. It was also, as I say, very helpful for our members to know that we were working with employers and that all of these measures had been discussed with us and looked at, and that we were comfortable with them, which helped our members to feel confident with going to work.
Thank you. When you were doing that piece of work, did you feel that you were addressing a need in terms of a gap in the information?
I think so, because it was partly about, there was lots of different bits of information, and it was partly about consolidating everything into one space, and also, yes, looking at things that perhaps hadn't been looked at specifically by the government. So things like how you deal with changing rooms in a clothing retailer. Should they be open? Should they be closed? Things like that, which hadn't necessarily been looked at in that level of detail. And I think it was helpful to have that, because have the people who were actually going to be implementing this directly involved in it. And I think the level of engagement there, because we worked directly together on it, was probably meant that we could get into a lot more detail.
Thank you. I'm going to re-ask my question now in relation to the later periods. Obviously, we had a stage where guidance came into place and matters got stricter and stricter, and then we moved into the later stages where matters began to open up again. Did USDAW have any concerns regarding guidance that was being issued during that period?
We did have some concerns. One of those was around, as I mentioned before, the reduction in social distancing from 2 metres to 1 metre, which was still relatively early in the pandemic. That was, I think, July 2020. we didn't think that that was substantiated really with evidence. We weren't engaged with on it. It wasn't discussed with us. And what actually happened in food retail was that employers continued to operate 2 metre distancing because it was already in place. It was already working. The way that things were set up were based around 2 metres, like the markers on the floor and things like that. So what actually happened in reality was that it was retained in most cases, and we engaged directly with employers on that and encouraged them to do that. I think another sort of key point for us was in July 2021 when the government was reviewing Scottish Government was reviewing the pathway out of lockdown. We wrote to the First Minister then to say that we felt that social distancing measures should still be retained at that point. The vaccine rollout hadn't yet reached everybody. We had members who were vulnerable, who were concerned about the impact of that. So we did write to the First Minister about that, and again we didn't get a response on that.
Just picking up on something you said there a moment ago about even when relaxations came in terms of social distancing, they were retained, and I think you said you made representations to the employers in that regard. Were the employers open to that maintenance, or was there any issue in that regard?
It's hard to remember exactly the sequencing of it, but I think we had... we were engaged with employers in risk assessments when social distancing was being reduced and when the restrictions were being reduced. So we encouraged, employers were required to have risk assessments, but we encouraged them to engage with us in their risk assessments, and that gave us an opportunity to look at specific measures or concerns that we had, and also to make sure that any workers who were vulnerable had whatever protection we could get them to agree to.
Thank you. One of the things that His Lordship will be considering in due course is the concept of the 4 harms. I don't know if you're familiar with that term. The Scottish Government used it in terms of balancing questions of health and both relating to the pandemic and more generally against economic questions and social questions. I wonder if you, or whether USDAW had any view in terms of that balancing exercise, whether they felt the government got that right or otherwise.
I think it was a difficult exercise, we acknowledge that, and we had, primarily we were concerned about our members' safety at work and their health, but we were also concerned about the economic impact of the pandemic on our members, particularly our members working in non-food retail, which was closed down for a significant amount of time. Some of our members were furloughed, which meant a drop in income to 80% of their income, which if you're already a low-paid worker is a significant and very difficult to bear. There were, I think, things like the reduction from 2 metres to 1 metre, the removal of the social distancing measures in 2021, those were times, I think, where we felt that the balance wasn't right, where we felt that the Scottish Government moved more quickly and without the evidence to come out of those restrictions. And the fact that they didn't engage with us specifically on those issues made that more difficult because we didn't have the opportunity to have the input on that and to find out exactly what the reasoning was behind those decisions.
Thank you. We've talked about the guidance and you've talked about some of the effects that has on workers. I'd like to explore that a little further with you, if I might. Again, thinking at the beginning of the pandemic, we heard earlier this week from the Scottish Retail Consortium about panic buying, and indeed I think it's mentioned in your statement that was rife. Did that have any consequences for retail workers?
It did. It put a huge amount of pressure on retail workers, and I think it's you know, it should be said that throughout the pandemic, retail workers made an absolutely incredible contribution to keeping Scotland going, keeping people fed, keeping allowing people to get everything that they needed. They didn't get the opportunity to work from home. They had to go into work every day, dealing with members of the public. So on top of that, there was this huge, at the very start of the pandemic, there was this huge increase in demand. I think there was £2 billion more spent on food and drink across the UK in March 2020 than there was in March 2019. So these were sort of unprecedented levels of increase in demand in such a short period of time, on top of the fact that social distancing measures were being introduced and retail workers were expected to implement those social distancing measures. As well as that, because of the nature of the pandemic, there were people having to isolate, so staffing levels were affected by that as well. Lots of retailers did recruit additional staff during that period, but the level of demand was so high that our members were really, really struggling. There were shortages of goods, and then that became a flashpoint as well for abuse and, you know, customers being unhappy, which then obviously had a further impact on our members.
Thank you. If I could just pick up, you've said quite a lot there. If I could just pick up on a few of those points. You mentioned social distancing, obviously measures being put in place, and we know, of course, I think we all experienced the kind of measures at supermarkets and things in terms of numbers of people entering the stores and product restrictions and the like. I think you said it, but I think it's worth emphasising. Whose responsibility was it to enforce those measures?
Well, the reality on the ground was that it was retail workers who were having to enforce them. In order to ensure that retailers were complying with the measures, it's the staff who have to make sure that customers are following them. And, you know, most people did follow the rules, but there was a significant minority who were not happy about having those rules imposed on them, and they didn't blame, they blamed the people who were in front of them, and that, unfortunately, was the retail workers. So at the start of the pandemic, implementing those rules actually became the biggest flashpoint for abuse and violence for our members, which prior to that it had been around age-related sales.
Thank you. And again, just to pick up the point you said there, you said abuse and violence. Were there actually instances of violence against retail workers? There were instances of violence. Unfortunately, violence happens in retail settings all the time, but it did increase during the pandemic. We did hear of incidents of people being spat at, being deliberately coughed on, really horrific incidents which made an already very stressful time for people who had concerns about catching the virus. It made it even worse. And I think there was one comment that a member made that's kind of always stayed with me, where she said, you see some customers, you see them distancing from each other, but they don't distance from us, and it's like they don't see us as people. And I found that incredibly telling about the attitude that some people have towards retail workers, and the lack of appreciation of the work that they do. Thank you. Were there any particular groups of workers that this particularly affected?
It was, retail workers working in store were obviously in the front line of dealing with the social distancing measures, dealing with customers, dealing with high levels of demand. Also, delivery drivers, grocery delivery drivers, there was a big increase in demand there. So they were extremely busy, and again, had concerns relating to the virus and relating to abuse sometimes. So there was that was a big issue for those workers as well.
And this may sound like a slightly tricky comment, but is there any particular time of day that occurs, or is it at any time?
I think Anecdotally, what we hear from members generally is that incidents of violence and abuse are worse during the evenings and late nights. What we did see is when there was a curfew brought in on pubs and pubs were closing earlier, that then created an increase after the pubs closed of incidents in stores after that where people were coming in to buy alcohol and were being abusive towards the staff. In general, it's the sort of unsocial hours is where it tends to peak, but I think during the pandemic, it was pretty much constant, I think.
Thank you. And in terms of those unsocial hours, is there any particular demographic that tend to work those unsocial hours?
It's often young workers. They often take the shifts that are late nights and weekends, and there does tend to be, again, anecdotally, we have heard that's puts them at higher risk of abuse and violence.
Thank you. In respect of the violence and abuse towards retail workers, have any steps been taken by government or others to address those?
So a significant step forward was the introduction of a specific offence of assaulting or abusing a retail worker, which was introduced through the Protection of Workers Act 2021. That was a bill brought to Parliament by Daniel Johnson MSP, which is something we'd been campaigning for a long time, and as had a number of other people involved in the retail sector. So the importance of creating a specific offence was firstly to send a signal about the fact that this is being taken seriously, but it also helps to it helps police forces to direct their resources, and it also helps with recording the numbers and generally just being aware of the level of the problem. So it's something that we very much welcomed, and we're very pleased to see also that is being followed in the rest of the UK now.
Thank you. You've mentioned obviously the difficulties of enforcing rules in respect of retail settings, and you mentioned other settings such as delivery drivers and the like. Were there any other settings that your members reported to you were having difficulties in terms of enforcing rules?
In terms of enforcing the rules, it was those frontline workers, but in terms of the way that the rules were being implemented, we did have members working in warehousing and distribution and food manufacturing, where sometimes social distancing was quite difficult to maintain, and those issues were sometimes raised. So it's not solely people who are dealing with the public who had concerns about the risk of catching the virus.
Does USDAW have members who work with funerals?
We do, yes.
Were they affected at all?
They were, unfortunately, because of the increase in the death rate, they were put under increased pressure, and there were restrictions on their work at the same time. So that did create a lot of difficulty for them, and I think the restrictions made their job is already a very sensitive job. They have to deal with people at the worst times in their lives, and because of the restrictions, the feedback that we had from some of our members was that they found it was more difficult for them to be able to support families because of the difficulties in being able to spend that time with people that they would normally be able to, and the reduced numbers being able to attend funerals and things like that, and also just the volume of work that they were doing at the time.
Thank you. You've spoken there regarding the significant pressures that were on retail workers and others at the time. What were the effects on the workers in terms of health or otherwise?
There was certainly an impact on workers' mental health as well as the risks relating to the virus. We know that many of our members were very worried about catching the virus, about passing it on to their relatives, particularly at the start of the pandemic when we didn't know very much about the virus yet. There wasn't testing in place, there wasn't vaccination program, so people were very, very concerned about that. And people, particularly people who already had pre-existing mental health conditions, they were often exacerbated by the pressures of working through the pandemic. In terms of the health impact, we know that many of our members contracted the virus. Sadly, some of our members will have died from the virus. And I think the STUC's analysis did highlight that women working in sales and elementary trades and related occupations, which includes those in elementary sales occupations, that mortality rates for women in Scotland were higher in those roles. So, we support the calls from the STUC for for the levels of distribution of occupational mortality in Scotland to be looked at by the inquiry, because we think that that's an important area that needs to be considered.
Thank you. When we spoke about key worker status, and obviously one of the important things that comes out of key worker status is the access to childcare. Aside from questions of key worker status, were there any other concerns affecting childcare, affecting your workers?
There were. Lots of our members don't use organised childcare or formal childcare because it's too expensive for them to access. So lots of our members rely on a sort of patchwork of informal childcare involving family, friends, perhaps working, two partners working opposite shifts. That became much more difficult for people to manage during the pandemic, partly because of pressure regarding their hours. There was key worker provision for our members who were working in food retail. That doesn't always fit with the shifts that you work in retail, for one thing. But there was also, we did have members working in non-food retail who were not considered key workers, who didn't have access to those provisions and who didn't have their usual network of support because of the requirements of the restrictions that they would normally be able to rely on to look after their children. So that meant some people had to cut their hours back. We believe that probably meant that some of our members ended up leaving their jobs completely, and that would have been disproportionately women that would have affected.
Thank you. You mentioned there a moment ago people's hours changing or having to change their hours because of childcare. We all know that the job market has changed significantly with things like gig workers and the like, and security of employment has obviously changed in consequence of that. Were there any issues arising out of those kinds of matters?
There's a long-term issue in the retail sector and in other sectors too around one-way flexibility, where essentially workers are expected to be very flexible in favour of the employer, but they don't have the security of the hours that they work. So quite often somebody will be contracted for quite short hours, not necessarily 0 hours, but maybe sort of 10 hours, 15 hours, but they're regularly working additional hours, but they don't have any right to those hours in their contract. So that is a long-term issue in the retail sector. During the pandemic, people were mostly working extra hours, so they were working those additional hours. They were being asked to work them, so financially that that was actually beneficial to some of our members. But then they kind of always knew that those hours could be brought back down as soon as they weren't needed anymore, so they don't have that security, which is why we have been campaigning for the right to a contract that guarantees your normal working hours, which is something that is hopefully going to be brought in through the Employment Rights Bill in Westminster now.
Thank you. We spoke about young workers and particular circumstances where their demographic was particularly affected. Did USDAW see any evidence of any other particular demographics of groups that were being particularly affected over the pandemic?
Yes, we did. One area that we looked at was the impact on our Black and minority ethnic members. We know that Black workers are disproportionately more likely to work in some of the higher risk frontline jobs, and so there was added risk to them from the virus. They're also more likely to be in low paid insecure work, and that makes it more difficult to for them to access paid time off for sickness. We found that more than twice as many of our Black members were unpaid during self-isolation or sickness than white members were. And they were 3 times more likely not to know what they were going to be paid as well, so there was a lot of insecurity there. Also, for our disabled members, a lot of our disabled members were concerned about the impact on them, particularly those who were clinically vulnerable. Our disabled members who continued going to work, a lot of them, we believe some of them found it more difficult to get reasonable adjustments and maintain their reasonable adjustments because of the pace of change that was going on at the time and the focus on other things. So that had an impact. And as I mentioned earlier, people with pre-existing mental health conditions found it particularly difficult dealing with the worry and anxiety around COVID. And also some of our members, our disabled members who were covered by mask exemptions, found themselves at the receiving end of abuse from customers for not wearing a mask, and then having to explain to people why they weren't wearing a mask, and then people saying, well, we have to wear them, why don't you, and that kind of thing. So that was also a difficult thing for people to deal with.
Thank you. You've spoken about members seeking advice during the pandemic. How did USDAW affect that advice, or what were the sort of channels of communication with its members at the time?
It was a combination of dealing with the queries as they came in. So we had quite a big upsurge in calls and email inquiries. So we were getting lots of queries from members asking about what the changes in the rules meant for them, whether their workplace was going to be open or not, what would happen if they had to isolate, things like that. We also communicated proactively with members, so sending out emails, putting information on our website. Also, we communicated through social media updates as well, which a lot of our members, we did have an increase in members following us on social media to keep up to date with the information that we were putting out on there as well.
Thank you. And were those queries fairly constant over the pandemic period, or was there anything that caused them to spike?
They tended to spike every time there was a change in guidance. At the start of the pandemic was probably the peak of the queries, as you'd expect, because this was unprecedented and people didn't know what was going to happen. But we did tend to get an increase in queries every time there was an announcement about a change in restrictions or anything that I think members thought was likely to affect them. And then we would, when we sent information out, inevitably then you get lots of queries coming back asking for further information about that as well.
Thank you. You mentioned the work that USDAW did with employers. I'd like to speak to you about that, if I may. How did you find employers' approach during the pandemic?
I think the employers who we dealt with, where we have good relationships with them and where we engage with them already, we worked well together in terms of us raising issues on behalf of our members and us asking them to implement various measures and us working with them to make sure that people had the information that they needed. So things like introducing perspex screens at checkouts and making sure that there were that there was the right signage in stores and things like that. Making sure that our members had access to facilities, hand washing facilities, and time away from their work to go and wash their hands and things. You know, those sort of things. We were having discussions with employers on a pretty much constant basis about, and every time an issue was raised with us by members that needed to be escalated, that was dealt with by our national officers, who have sort of pre-existing relationships with those employers and would have been engaging with them.
You mentioned there the installation of perspex screens. There's actually a number of measures which are mentioned in your statement. I'll just read some of those. Installation of perspex screens, introduction of queuing systems outside stores, reduction of checkouts open, regular cleaning and sanitising, customers paying by cards, all these kinds of inputs. Did you find that employers were open to that kind of input from us, though?
Yeah, they were. They had, I think we had a shared interest in making sure that workers were kept safe, and they also wanted to make sure that customers felt safe as well, because people will want to go shopping somewhere where they feel safe. So I think they did engage with us. As I say, those where we have existing relationships, they engage with us in a positive way around those measures.
Thank you. We've discussed already the input which USDAW had in relation to national guidance or guidance that's being applied generally with the Scottish Government. You've mentioned obviously the specific things you asked people to do, but did USDAW have input into any other particular policies for workers? For example, you mentioned delivery drivers earlier on.
That, I think those things would have been raised through the retail subgroup. When it comes to the delivery drivers specifically, that I believe was dealt with at employer level mostly, when we were getting into the detail about like how social distancing would work practically in those roles. So things like delivery drivers wouldn't go into people's houses; they would leave the goods on the doorstep, that sort of thing. There was the input through the retail subgroup on various pieces of guidance that were issued, but I think sometimes when we got into the detail of it, that was more done directly with employers.
Thank you. You've mentioned obviously the positive things that employers were doing. Was there anything negative that they weren't doing, or things they were doing they shouldn't have been doing?
There's always incidents where policies are not being applied properly, and that did happen. Sometimes we would have feedback from members about that they'd got the wrong information, or that measures weren't being implemented properly in their workplace. That does happen, and it can happen, and where we have a relationship with the employer, we would escalate that and deal with it. We did get some information from either members or members of the public who'd been in a shop, perhaps in one where we weren't a recognised union and we didn't have the relationship with the employer, where they felt that social distancing wasn't being practised. and where we were able to, we raised those issues with those employers, but it's obviously much more difficult when you don't have a relationship with them and you're not a recognised trade union.
In your statement, you refer to particular issues with pregnant women.
Yes.
Could you tell us about that?
So at the start of the pandemic, we had a number of issues from relating to members who were pregnant because guidance at the time was that pregnant women were to be considered clinically vulnerable, that they should take extra precautions to against contracting the virus. What happened as a result of that in a number of cases is that those women were told not to come into work, and they were put on sick pay, essentially. That shouldn't have happened, because what should have happened is that if a pregnant worker is at increased risk, the employer should try to mitigate that risk. If they can't mitigate that risk, that employee should be put on paid maternity suspension without any detriment to them. That wasn't happening, and I think that was partly because employers were not aware of those provisions, and there was not any clear guidance put out by the government about it. So we raised that on behalf of our members where we were aware of it, and we got that resolved, and employers did, accept the correct position. And there was, I think later on, there was some guidance put out by the UK government on it, but it took, the length of time that it took will have meant that there will have been women who lost out on pay as a result of that, and who, perhaps if they haven't got the benefit of trade union representation, probably never got that pay back.
Was there anything that could or should have been done to mitigate that position?
I think clear guidance to employers about that, because it was foreseeable that would be an issue. I think it was clearly, if pregnant women are at an increased risk and they are dealing with the public, and employers are going to take steps to protect them, as they should, consideration should be given to what impact that's going to have on those women and their pay. And it seems that wasn't something that was considered, because it's an employment law matter, so it's not directly within the powers of the Scottish Government, but that doesn't mean that they couldn't have put some information out to employers. They could have included it in their guidance.
Thank you. USDAW obviously operate across the four nations, across the UK. I wondered if you, from your experiences, whether there were any differences that you might want to note between the four nations?
I think it's difficult really to make an assessment on that, because the nature of my role was that I was more directly involved in the discussions with the UK government. I was supporting colleagues in Scotland. I think we engaged with government in all of the administrations, and there were things that we had regular meetings in Scotland, but like I say, the issue that the feedback that we had on that was about the guidance being issued quite late, and there not being the opportunity for meaningful input. I think we were involved in meetings which I supported officials for with the UK government as well, and there were probably similar concerns about the guidance being issued late and us not necessarily having enough opportunity to have meaningful input.
Do you feel that the responses from the two governments, but I'm talking particularly the UK and the Scottish government in this context, do you feel that the response or responses between the two governments were sufficiently joined up?
I don't think that there was enough joined up response, because different announcements were being made at different times. It caused confusion, different guidance being issued. I think if there had been more of a join-up response, it would have been helpful to retail workers. It would have been helpful to retail employers as well. When you have a retail employer where decisions are being made at UK level, that they're then having to make they're then having to separate that out into the different nations. It is more complicated and it's more difficult.
Thank you. Ms Cairns, that's all the specific questions I had for you. I'm going to give you an opportunity in a moment, if there's anything that you or USDAW wants to raise with His Lordship, if there's any particular key matters that you think we haven't covered that you want to raise with him, I'm going to give you that opportunity to do so. Before I do that, I'll just remind you that we've obviously got your statement. Everything within that statement will be considered by the inquiry and by His Lordship. Similarly, the documentation which has very kindly been provided by USDAW. But if there is anything else you wish to particularly highlight to His Lordship, now is your opportunity. Thank you.
I'd like to. I'm grateful for the opportunity to address the inquiry and to talk about the experiences of USDAW members. I think, as I already mentioned, the contribution that retail workers and distribution workers and people throughout the supply chain made during the pandemic was absolutely critical, and that contribution needs to be recognised and they should be respected for the work that they do. And we've talked about the Protection of Workers Act, which was a really important step forward, but we still, violence and abuse against retail workers still happens on a daily basis. So there is still work to be done in terms of protecting retail workers and improving their working lives. Also, I think one thing that, reflecting on the engagement with the Scottish Government during the pandemic, one thing that I think, as well as a more joined-up approach across the nations, if we had had more consistent joint working with government outside of the pandemic, I think it would have helped that process during the pandemic if we already had relationships that were, that involved us working jointly together. I think that would have significantly helped, and I think that it would help with a number of other challenges that face workers and employers now and in the future. So I think that would be an important lesson to learn for the future as well.
Thank you. My Lord, I have no further questions unless your Lordship has anything to add.
Nope, nothing to add. Thank you, Mr. Turner, and thank you, Miss Cairns. That's all. We'll break now till 1:15.
Thank you, my Lord.